So as I emerged through childhood into teenage years, I was very focused on the health sciences field and got to college and decided I was going to focus on being pre-med. I had amazing experiences in undergrad where I got to travel to East Africa and spend time learning about global health in that setting, and was just fascinated by the way people experience health, wellness, and also illness, depending on who they are in the world and what their lived circumstances were, their lived realities were. And I saw a lot of that and developed a profound understanding of that from my time in Africa. And when I got to medical school, I entered medical school with this declaration that I could see myself doing anything in medicine but pediatrics. I don't know why I had that construct, but I was determined, it's like, I don't think I like working with kids. That's not for me. I thought I would do focus in OBGYN because I loved caring for women and I loved the concept of women being well means that the family unit is well. That was what I observed in my life, my family. When my mom was not well, none of us were well emotionally as a family. So I was very interested in understanding how to support women. So I thought OBGYN, maternal child health, naturally. And I started rotations. I started with peds. And what blew me away was actually the way I could connect with parents, not just moms, fathers as well. My heart just lit up around this very intimate connection of working with people when their children were not well. How do I help support them in their perspective of what's important? How do I help advocate? And I saw that opportunity not just with me as the physician working with parents in the family unit, but on a bigger scale, when you think about caring for children, you're not just concerned about what's happening with their parents and their family life, but what's happening in their community, who is around this family and this child supporting them. And that is very much how I'm oriented. I am an advocate, I'm a community engager. This is who I am. So I loved my peds rotation. I was so fascinated by the science in it, the interesting medical conditions you see children experience, and then many times they're resilient through the most challenging of circumstances. I love being in community with people, in conversation with people, and there's not as much time for that in surgery.